Hello and welcome to Module 2 for 150, Nursing 150. For this presentation, we're just going to talk about lupus and Lyme disease. So in the last presentation, we talked about the immune system. And the immune system, when working as it should, helps us to maintain our health by protecting us from outside influences causing disease. What happens with the immune system that causes disorders is it can either be hyperactive or hypoactive. In lupus, the immune system is a little bit hyperactive, and that causes what we call autoimmune disorders. A lot of the diseases that we talk about actually in this course are autoimmune diseases, and it's when the immune system is just overreactive and hypersensitive it has a hypersensitive reaction to something, and it kind of is like the body attacking itself because it identifies something in the body as foreign. So lupus is an autoimmune process where these antibodies attack the DNA and the RNA in parts of the cell, and basically the result is inflammation. So it causes inflammation in areas, and it damages and destroys some areas. There are a couple different types of lupus. One only affects the skin. The other one is the systemic lupus, which is most prevalent. The one that attacks the skin is there's a very small number of that. It typically is systemic, which means it affects all body parts. We'll talk about that in the next few slides. So these are the two main classifications. The discoid lupus is the type that only affects the skin. So you'll see, and we'll have some pictures of this in the next few slides. But it causes the butterfly rash on the face. It's very distinctive. The word erythematosus, which I can't even say very well, is basically referring to the redness that it causes on the skin, the red rash that it causes. That's where that word comes from. Erythema, if you might recall, does mean redness, so that's where that word comes from. Typically, it affects women more than men. It's usually in the childbearing years of 20 to 40 years of age, which can be very inconvenient for a young woman who is typically 20 to 40 years of age, trying to have a career, make a living, maybe go to school. So it can be psychologically kind of a devastating disease. The thing about lupus is that there's varying levels of it. Some people have every manifestation of lupus. They have lots of exacerbations. Other people have very, very few symptoms. You wouldn't even know they were sick. So there's lots of varying degrees of lupus that you'll see in patients. So typically with the systemic lupus, basically the biggest problem they typically have is the kidney dysfunction. It will attack the glomeruli of the kidneys, and they will lose use of their kidneys. And that's typically what causes death with a patient with lupus. Other causes, when it involves the cardiac and central nervous system, it can cause some definite complications, if you can only imagine the cardiac. A lot of times they'll get pleural effusions. They'll have some pulmonary issues, just where it's attacking the tissue of these organs, and it causes inflammation in these organs, and it can really cause some complications. This is just a visual of the butterfly rash that you'll see with lupus. Again, it's just talking about the redness. That stems from that word erythema. Again, just a visual, talks about pleural effusion, the heart problems, the nephritis that they get. They can get the Raynaud's phenomena. A lot of times they get a lot of times the systemic, they'll have the skin issues along with the systemic issues. So they get a lot of redness, dry areas all over them, along with the butterfly rash on their face. This is just a list of all of the complications that come along with lupus. Again, like I talked about, with a young woman from 20 to 40 years of age, these can be very non-convenient issues to have when you're trying to raise a family, make a living. So there's a lot of psychological effects that goes along with these. This is a psychological assessment, so you need to make sure that you assess them to find out how they are tolerating it, how are they dealing with it, and think about how a nurse can help someone with lupus kind of get resources, get help, make sure they have people at home that are helping them if they already have kids. Do they have support system? It's an unpredictable disease. It can be very devastating to some. It can be very mild in others, so it's unpredictable. They can have exacerbations. They can have times when they feel really good, times when they feel really bad. So it can be psychologically devastating. Going into the lab assessments, the skin biopsy, they can biopsy those areas of the redness to kind of confirm a diagnosis of lupus. ANA and ESR are labs that can be done to determine if there's inflammation in the body. ESR means erythrocyte sedimentation rate, and that when that is high, when that is elevated, that means that there is inflammation somewhere in the body, so it can be an indicator of lupus and lots of other inflammatory disorders. ANA is kind of the same thing. It can be a good indicator of inflammation in the body. They use that a lot for arthritis and rheumatoid arthritis to determine inflammation in the body. CBC with diff. So we talked about in the last presentation about a complete blood count. Complete blood count tells you what your red blood cells are, what your platelet level is, what your hemoglobin, your hematocrit is, just a complete count of the cells that are in your blood. And if your white blood cells are elevated, that can tell you that there's an infectious process, there's an inflammatory process going on. A patient with lupus has something called pancytopenia. Can be found on page 345. Basically, that means there's a decrease in all cell types. So everything, the red blood cell count is low, the white blood cell count is low, H&H is low. So all of their CBC is low. And basically, they think it's caused by a direct attack of blood cells or bone marrow by this immune response. They also monitor, their serum electrolyte levels, and they look at their renal function to determine if the lupus has affected their kidney function as well. But these are the main labs that they're going to be looking at. So these are the medications listed for lupus. NSAIDs, so non-steroidal anti-inflammatory medications. So if you think about what lupus is an inflammatory process. It's an autoimmune inflammatory process within the body. So we are going to give them medications to stop the inflammation process. So it's an anti-inflammatory medication. Those are Tylenol, Motrin, those types of drugs. And we're going to be looking at NSAIDs throughout this course. They're very common medications that are given for anything that's an inflammatory process. Corticosteroids and immunosuppressants are used to decrease that immune response. So that autoimmune response that's going on, causing the body to sort of attack itself. These drugs are aimed at lowering that autoimmune response. Here's the thing about these drugs, especially your immunosuppressants. They not only suppress that immune response that's causing the lupus, but it can depress their immune response. So when somebody is taking immunosuppressants, they are lowering their immune system, so they need to be very careful. They need to avoid crowds. There's a lot of teaching involved in these medications. They need to take care of themselves, stay away from people who are sick, because their immune system is going to be compromised by taking these medications. Plaquenil is a common anti-malarial medication. This medication is used for patients who have this skin condition related to lupus. It could be with the DLE or the systemic lupus. Big thing with that medication is that they need to be careful as far as they need to have frequent eye examinations if they're taking Plaquenil. So as you're going through these medications, make sure you're kind of thinking about the things that you need to teach your patients about each one of these. Staying away from crowds is a big thing. frequent eye exams with the anti-malarial. Just kind of keep that stuff in mind as you're reading through. So there's a lot of education that needs to be done by the nurse for a patient with lupus. Skin protection is a big thing that they need to understand. They are at risk for having complications with their skin. There's a good chart on page 346. It's chart 2012. It talks about skin protection in patients with lupus. A lot of it talks about avoiding direct sunlight, wear a hat, long sleeves, long pants, avoid the sun, wear sunblock. They need to understand that decreases their exacerbations with their skin issues. Pregnancy, as you can imagine, they're 20 to 40-year-old women who are of childbearing years, so they need to think about people who have all the manifestations or very serious manifestations of lupus. A pregnancy may not be the best idea for them because a pregnancy could stress the body and actually cause exacerbations in a person with lupus, so a conversation needs to be had with them about whether it's a good idea or not. Community resources, it's always good to have people out in the community, other people with lupus that they can talk to, what they've, so they can talk about just treatments and how they're getting through this kind of disease process. So a lot of nursing care is involved with a patient with lupus is education, as most other disease processes are. Okay, moving on to Lyme disease. Lyme disease is an infectious disease. It's caused by a tick. Most people already know that. It's an infected deer tick, which is also known as a black-leg tick. It's most common in certain areas of the United States and Europe. I think in the United States around here it's more like the East Coast, New England areas, Maryland, Virginia, those kinds of areas. Different stages of Lyme disease can be noted. Typically in stage 1, someone will notice that bullseye lesion. I think I have some pictures of that in the next couple of slides. It's a rash that looks like a bullseye, basically, that at the site of where the tick infected the patient. The patient will manifest with flu-like symptoms, so it's kind of hard to diagnose at first. They think they might just have the flu. And then they find that rash, and then they start getting these muscle aches, joint stiffness, that kind of stuff, and that will kind of indicate that they don't have just the average flu symptoms. Once they are determined to have Lyme disease, they need to be treated with an antibiotic. Usually a penicillin is something that they use. Doxycycline or amoxicillin is a typical drug that they use to treat it. However, if they do not get treated, they can move on to stage 2, and then they can have actual more serious complications, which can end up in carditis, palpitations, meningitis, lots of different complications. So the longer they go without treatment and proper diagnosis, the more symptoms you're going to see in the patient. So this is just a rundown on the stages of Lyme disease, and then the other picture is just something that as a nurse you need to be able to educate your patient on how to prevent it, because prevention is key in this as in similar disease processes. They need to know that they need to wear bug spray, they need to wear long sleeves, long pants when they're out in the woods, if they're doing anything that might put them at risk for getting a tick bite. They need to use repellent and cover their body, keep them from being exposed to where a tick can get. Wearing light clothes is better because they can, after they're finished being out where they are, they can inspect themselves. It's easier to see a tick when they have light clothing on them. And there again is a wonderful table on page 353. It is chart 2015. It talks about prevention and early detection of Lyme disease. I would review that table. That's a great table because that helps you understand as a nurse what you should be doing to help prevent Lyme disease in a patient. This is the rash that you'll see in a patient. The top one is definitely that bullseye rash that would indicate that someone may have Lyme disease. That concludes this portion of Module 2. You guys have been great so far. Continue to work on your PowerPoints, and I will see you soon.